The cold, sterile air of the Pinnacle Suite hummed with frantic energy, a stark contrast to the patients splayed beneath the unforgiving surgical lights. Dr. Julian Thorne, sweat beading on his brow despite the Arctic chill, cursed under his breath, his designer scrub cap askew. The monitor's insistent beeps accelerated, a horrifying cadence of impending failure. "We're losing him." Dr. Lena Sharma snapped, her gaze accusing, sweeping past the junior staff as if searching for a scapegoat. Her eyes lingered on Nurse Elara Vance, neat as always, tray immaculate, barely visible in the periphery. Elara's own internal world, however, was a maelstrom of geometric precision. The chaotic field before them, a tangle of blood vessels and tissue, began to resolve in her mind's eye. She saw the network, not as a confusing mess, but as a complex, three-dimensional map. Thorne barked orders, his frustration a palpable heat. "Vance, just focus on keeping that tray organized." Sharma chuckled, a dismissive sound. They saw a meek girl, overlooked and unremarkable. But Elara saw a subtle, shimmering shadow, a minute deviation in the bleed pattern that no one else registered, a secret pathway to a solution hidden in plain sight. Her quiet genius was about to be unleashed. The subtle, shimmering shadow, a minute deviation in the bleed pattern that no one else registered, pulsed in Elara's mind's eye. It was a secret pathway, a solution hidden in plain sight. Her hands, despite her calm exterior, tingled with the silent hum of insight. "Scalpel, Vance." Dr. Julian Thorne's voice, sharp as the very instrument he demanded, cut through the sterile tension. His designer scrub cap, emblazoned with a discreet, stylized JT monogram, gleamed under the surgical lights. His brow was furrowed in a mask of intense concentration, but Elara saw the flicker of frustration in his eyes. He was missing something crucial. She presented the scalpel with practiced grace, its polished blade reflecting the blinding light. Thorne snatched it without a glance, his focus entirely on the wound. "Damn it, the pressure isn't stabilizing. More suction, team. We're losing too much." The patient's vitals on the monitor, a stark digital display of their failing life, continued their relentless descent. A low, anxious murmur rippled through the assembled medical team, the anesthesiologist adjusting dials with frantic precision, the circulating nurses exchanging worried glances. This was a VIP patient, a titan of industry, and the stakes in the Pinnacle Suite were always stratospheric. Failure here was not just a medical outcome, it was a blot on St. Augustine's pristine reputation, a dent in Thorne's unblemished record. Dr. Thorne, estimated blood losses now, concerning, the anesthesiologist reported, his voice tight. Thorne swore under his breath, a low, guttural sound that radiated his mounting stress. He manipulated the tissue, his movements precise but increasingly agitated. "It's like trying to plug a sieve. The primary source is under control, but this diffuse ooze, it's unrelenting." He glanced up, his eyes sweeping the team, settling briefly on Elara, then moving on as if she were a fixture, not a participant. "Sharma, take over suction. Vance, ensure those irrigation fluids are ready. And for God's sake, keep that tray spotless." Dr. Lena Sharma, Thorne's senior resident, smirked as she took the suction wand. Her own scrub cap, a chic deep emerald, contrasted sharply with Elara's plain, standard-issue white. "Right away, Doctor. Don't want our junior staff muddying the waters, do we?" Her tone was laced with a thinly veiled condescension that pricked at Elara, though she never let it show. Sharma often used these subtle barbs, a social weapon to enforce the strict hierarchy and remind Elara of her place, at the very bottom. Elara nodded silently, her gaze remaining on the surgical field as she meticulously arranged the saline bags. The diffuse ooze Thorne spoke of was precisely what she was seeing, not a random leak, but a specific, almost geometric pattern that suggested a deeper, systemic issue, a small, overlooked collateral vessel caught in an unusual anatomical arrangement. Her mind raced, mapping out the intricate vascular tree, tracing the likely path of the unseen culprit. It was a problem of spatial geometry, a puzzle her unique mind was wired to solve. "We need to identify this secondary bleed now," Thorne demanded, his voice rising. "Sharma, explore the superior mesenteric branch again. Vance, hand me a longer forceps." quickly. Elara moved with her characteristic efficiency, her movements fluid and economical. As she presented the forceps, Sharma scoffed. "Careful, Vance, don't trip over your own feet. You look like you're half asleep." "I'm awake, Dr. Sharma," Elara replied, her voice soft, almost swallowed by the ambient hum of machines and Thorne's muttered commands. Sharma chuckled, a sharp, unpleasant sound. "Oh, I'm sure. Just not actively participating in the thought process, are we? Some people are just built for grunt work, I suppose." She made sure Thorne was within earshot, angling for his approval. Thorne, absorbed in his increasingly desperate exploration, seemed to implicitly agree with Sharma's assessment, his silence a powerful form of dismissal. The patient's blood pressure continued to drop. The anesthesiologist announced another unit of packed red cells was ready, a grim indicator of the crisis's escalation. Thorne's forehead was now slick with sweat, his confidence beginning to crack under the relentless pressure. He snapped at a circulating nurse for a minor delay in retrieving a suture. Elara's internal map solidified. She saw it, a small, arterial branch, unusually tortuous, hidden beneath a fold of peritoneum, just lateral to where Thorne was currently focusing. It wasn't a large vessel, but its persistent, slow leak, exacerbated by the patient's critical state, was slowly draining their life force. The pattern of the diffuse ooze was not diffuse at all, but a specific spray, ricocheting off internal structures, creating the illusion of a widespread issue. She hesitated, her quiet voice almost lost to her, but the urgency of the moment spurred her. "Doctor, with respect, perhaps the bleed isn't coming from that branch, but slightly more, caudal, almost obscured." Thorne paused, his hand hovering over the surgical field. He slowly turned, his eyes narrowing. "What did you say, Vance?" His tone was icy, the sort that made junior staff shrink. Sharma's eyes gleamed. "She's offering a diagnosis, Dr. Thorne." Our quiet, unassuming scrub nurse, suddenly a diagnostic genius. Her voice dripped with sarcasm. "Perhaps she's been reading too many medical dramas, imagining herself in the spotlight." "I observed a specific pattern in the rebound," Elara tried, her gaze fixed on the field, not on Thorne's furious face. A small, almost invisible jet deflected. Thorne's nostrils flared. "Observed, Vance? You're here to assist, not to interpret. Are you suggesting I'm missing something, in my own operating theater, on a patient of this magnitude?" His voice was a low growl, laced with incredulity and simmering rage at the perceived insolence. "Get back to your station. And if you have any more observations, keep them to yourself. Your job is to keep that tray clean and anticipate my next instrument. That's it." He turned back to the patient, resuming his fruitless search in the area he'd identified, ignoring Elara's suggestion completely. Sharma exchanged a triumphant, pitying look with one of the junior residents, who quickly averted his gaze. The humiliation was palpable, a hot flush spreading across Elara's cheeks, not from embarrassment, but from the searing frustration of being ignored when the solution was so clear. "Look, Thorne's getting agitated," Sharma whispered, just loud enough for Elara to hear. "It's moments like these that separate the true surgeons from the accessories." Elara felt the despair rising, a bitter taste in her mouth. She could see the problem, could almost reach out and point to it, but her words were dismissed as the idle chatter of an irrelevant subordinate. The patient's condition continued to deteriorate. The monitors shrieked a fresh alarm, a sharp, piercing sound that cut through the sterile calm, announcing another precipitous drop in heart rate. The team scrambled, Thorne barking orders, his face now a mask of desperation. The elegant Pinnacle Suite, usually a sanctuary of controlled excellence, now felt like a high-tech cage, closing in. Elara stood utterly still, her hands trembling slightly, watching the life drain from the patient, a silent witness to a tragedy she knew how to prevent. Her quiet genius, trapped behind the impenetrable wall of arrogance and dismissal, was a scream that no one could hear. The elegant Pinnacle Suite, now a crucible of chaos, buckled under the weight of the escalating crisis. The patient's heart rate continued its precipitous decline, the monitor's frantic beeps accelerating into an unbroken shriek that seemed to mock Dr. Thorne's increasingly desperate efforts. Sweat plastered the chief surgeon's designer scrub cap to his forehead, his usual composed features contorted into a grimace of panicked frustration. More blood. Increased pressors. What are we missing? He roared, his gaze sweeping over the sterile field as if a solution might materialize from the polished chrome. Elara's own heart hammered against her ribs, a counterpoint to the electronic dirge. She felt the chill of impending death in the room, a cold certainty that settled deep in her bones. Her gaze, however, remained fixed on the patient. Not on the primary incision, which Thorne was frantically exploring, but on a subtle, almost imperceptible, modeling of the skin just superior to the clavicle, and the faintest, anomalous ripple in the vein of the patient's neck. Her mind, in its silent, intricate dance, was already building a three-dimensional map, tracing a hidden pathway, a subtle leakage that defied conventional detection. It wasn't where Thorne was looking, it was deeper, more insidious, an almost invisible tear in a critical, high-pressure vessel. "We're losing him, Julian." Dr. Sharma's voice, usually crisp, was edged with genuine fear. BP unrecordable. Cardiac output plummeting. She glanced at Elara, who had instinctively leaned forward, her body language subtly shifting as her intuitive certainty grew. "Nurse Vance, your tray." Sharma snapped, her tone sharp with annoyance. "Focus on your duties. This is a critical moment." Elara's gaze, momentarily diverted, flickered to Sharma, then back to the patient. Her gloved fingers, usually still, twitched, a phantom tracing of the aberrant vessel she saw so clearly in her mind's eye. The problem wasn't a conventional bleed from the surgical site. It was something else, something only her unique spatial reasoning could discern from the scattered data points of vitals, subtle discoloration, and the almost imperceptible tremor of the patient's chest wall. The distal, anastomosis, Elara murmured, her voice barely a whisper, an involuntary attempt to articulate the complex solution already formed in her mind. Her eyes, usually downcast, met Thorne's for a fleeting second, burning with an uncharacteristic intensity. Thorne, however, was in no state to interpret nuance. His face, slick with sweat and fear, twisted into a mask of pure irritation. He was already drowning, and Elara's soft suggestion was just another droplet in the deluge. "What was that, nurse?" he snarled, turning from the operating field with a sudden, furious jerk that almost sent a scalpel clattering. "Did you just offer a diagnosis?" His voice was low, dangerous. "Or perhaps you were simply clearing your throat with particularly bad timing?" Sharma seized the opportunity. "She's just nervous, Dr. Thorne. The pressure is getting to her. Perhaps she should step out if she can't maintain composure." She shot Elara a dismissive look, her lip curling in thinly veiled contempt. "It's not a performance review, Vance." The heat of humiliation flared in Elara's cheeks, but it was quickly eclipsed by a surge of desperate urgency. The patient was dying. Her quiet genius, which had always been her private burden, was now a public curse. She swallowed, gathering her courage. "Dr. Thorne, I believe there's an unusual pressure differential. A tear, perhaps. In the superior vena cava, just proximal to the right atrium. It's very small, but with the pressure." Thorne laughed, a short, harsh, humorless bark that cut through the frantic beeps of the monitors. It wasn't a sound of amusement, but of contempt and profound stress. "An unusual pressure differential, Nurse Vance? And a small tear in the superior vena cava, which, I might add, our most advanced imaging failed to detect just hours ago." He threw his gloved hands up, splattering a few drops of blood onto the sterile drape. "Are you implying that my surgical team, my instruments, my experience, are somehow inadequate, and that your intuition has suddenly unlocked the mysteries of the universe?" He took 2 furious steps towards her, his eyes blazing. "Let me be clear, Nurse Vance. You are a tray nurse. Your job is to hand me instruments, keep the field clear, and stay silent. You are not a surgeon. You are not a diagnostician. And you are certainly not qualified to question my judgment, particularly not with your vague, unsubstantiated feelings during a life-or-death situation." His voice rose, echoing off the sleek, silent walls of the Pinnacle Suite. Sharma stepped forward, her voice dripping with mock concern. Perhaps Nurse Vance needs a break, Dr. Thorne. She's clearly overwhelmed. This isn't a rural clinic, after all. We deal with complex cases here. The implication was clear. Elara was out of her league, a country bumpkin in an elite operating theater, and her humble background was showing. The word stung, burning Elara's ears, each one a fresh lash. Her hands, which usually held her pristine tray with unwavering steadiness, now trembled visibly, a tremor that traveled up her arms and seized her entire body. She felt herself shrinking, becoming the invisible, insignificant figure they all perceived her to be. Her genius, her certainty, felt like a shameful secret, a delusion. She could feel the stares of the other nurses, the anesthesiologist, the circulating staff, all eyes of judgment and thinly veiled pity. This was the peak of her humiliation, not just a professional slight, but a public declaration of her utter worthlessness in a moment of critical need. "Get back, nurse," Thorne commanded, waving her away dismissively. "You're cluttering my sterile field with your observations." He turned back to the patient, his face a mask of defeat, his own tools now useless. The monitors screamed a flatline. The anesthesiologist announced, asystole. Starting chest compressions. A wave of despair washed over Thorne. He leaned over the patient, watching the futile compressions, his shoulders slumping. He had run out of options. Every textbook solution, every cutting-edge technique, had failed him. The celebrity patient, the hospital's reputation, his own career, all dissolving into the cold, clinical reality of death. His gaze, devoid of hope, swept around the room one last time, landing once more on Elara, who stood frozen at the periphery, her eyes still locked on that subtle modeling, that almost imperceptible ripple. Something in her unwavering, silent focus, even now, in this moment of abject failure, snagged his attention. A desperate, irrational flicker of a thought crossed his mind, born purely of exhaustion and the terror of losing. "Fine!" Thorne roared, his voice hoarse with a raw blend of fury and utter desperation. He pointed a gloved finger, not at the patient, but vaguely into the air above the mediastinum, an area impossible to access directly. "You think you see a phantom bleed, a microtear that's invisible to everyone else, even our most advanced angioscopy?" He gestured wildly, his eyes wild. "Then you tell me, Nurse Vance. Pinpoint the exact location of this ghost in the machine. Show me, precisely, the vessel, the tear, the exact anatomical point where this patient is drowning from the inside. And tell me how, exactly, to reach it without tearing the entire aortic arch to shreds and ending this farce right now. Because I am done. If you're so observant, prove it. Show me the impossible. Hey, you! If this story, centered on, story's central theme, resonated, and you crave more narratives that challenge and inspire, hit that subscribe button. Join our community. Let's keep exploring profound truths, together. Be part of it. A heavy silence descended, thick and suffocating, after Dr. Thorne's explosive challenge. Every eye in the Pinnacle Suite snapped to Elara, expecting her usual polite retreat, a mumbled apology for her presence. But something shifted in the young nurse. A fragile, almost imperceptible tremor ran through her, not of fear, but of a long-suppressed energy finally stirring. Her gaze, usually lowered, rose to meet Thorne's, holding a surprising steadiness. "If you are done, Doctor," Elara said, her voice soft but clear, cutting through the residual tension like a finely honed scalpel, "then perhaps I am just beginning." She took a deep, fortifying breath, her eyes sweeping over the patient on the table. She didn't move towards the monitor showing the chaotic vitals or the sterile trays of instruments. Instead, she took a single, deliberate step closer to the patient's side, her head tilted almost imperceptibly. Her fingers, usually busy with organizing instruments, now rested lightly, respectfully, on the patient's pallid forehead. It wasn't a diagnostic touch, not in the traditional sense. It was a connection, a way to filter out the noise and listen. The room held its breath. Dr. Sharma snorted, a low, dismissive sound that bounced off the polished surfaces. "Oh, please. Is this a seance now, Nurse Vance?" Or are you going to divine the location with your intuition? Her sarcasm dripped like venom. Elara ignored her. Her eyes, usually so neutral, now held an intense, almost frightening focus. She wasn't looking at the patient, she was looking into him. The basic, slightly ill-fitting scrubs seemed to melt away, revealing not a frumpy nurse, but a conduit of pure, unadulterated perception. Her mind began to work, a silent, internal explosion of data. The faint, almost invisible tremor in the patient's carotid pulse, the subtle, asymmetrical pallor of his left hand compared to his right, the minute fluctuations in the blood pressure cuff that no one else had bothered to correlate beyond a general decline. These weren't just symptoms, they were pieces of a vast, intricate puzzle. Inside Elara's mind, the human form unfolded. It wasn't an anatomical drawing or a 3D MRI render. It was a living, breathing, phosphorescent map, glowing with the patient's unique physiology. Layers peeled back effortlessly, skin, muscle, bone, fat. Then came the intricate latticework of vessels, arteries, veins, capillaries, shimmering with the flow of lifeblood. She saw the aortic arch, not as a textbook diagram, but as a vibrant, pulsing highway, its branches fanning out like delicate, vital roots. The usual cacophony of the surgical suite faded into a distant hum. Elara was utterly absorbed. Her visual intelligence, her ghost sight, wasn't just observing, it was reconstructing, hypothesizing, and verifying. She mentally traced the path of the systemic hemorrhage, the way the pressure drop correlated with the specific pallor, the way the fluid was pooling. She saw the turbulent, chaotic patterns within the angiography images that had stumped Thorne, and in her mind, those chaotic patterns began to resolve into a distinct shape, a specific point of disruption. Her eyes narrowed slightly. The ghost in the machine, as Thorne had called it, materialized in her internal vision. It wasn't a gaping tear, which would have been easily visible. It was a minuscule, almost microscopic fenestration, a tiny, imperfect opening, on the posterior wall of the subclavian artery, just as it branched off the aortic arch. Its position, hidden behind a fold of tissue and perpetually collapsing under the turbulent flow, was why even the most advanced angioscopy had missed it. It was like trying to see a shadow cast by a shadow. And then, the spatial reasoning clicked into place. How to reach it? The aortic arch was a minefield, a single misstep catastrophic. But Elara's mind ran simulations, hundreds of them in an instant. She mentally manipulated instruments, navigating the complex web of vessels, calculating angles of approach, predicting the subtle shifts of tissue under pressure. She saw a pathway, daring and unorthodox, but precise. She opened her mouth, her voice still quiet, but imbued with a new, unwavering authority. The leak is not a tear, Dr. Thorne. It's a fenestration, a congenital weakness, on the posterior wall of the left subclavian artery, approximately 2 centimeters from its origin at the aortic arch. It's collapsing under the blood pressure, which is why it evades visual detection. Dr. Thorne's dismissive scoff died in his throat. He leaned in, a flicker of something unreadable in his eyes. Dr. Sharma, who had been about to interject, froze, her jaw slackening. And the approach? Thorne managed, his voice now devoid of its earlier bluster, a hint of grudging curiosity. A direct incision into the subclavian is too risky, the wall too fragile, the arch too close. We'll need a retrograde approach, Elara continued, her words flowing with the certainty of a blueprint. Access the femoral artery, guide a microcatheter through the descending aorta, up and over the arch, and into the left subclavian. Once the catheter is past the fenestration, inflate a microballoon to temporarily occlude the distal artery. This will reduce the pressure and allow the vessel to distend, exposing the defect. She paused, her eyes still locked on the patient. From there, a targeted, controlled injection of a fibrin sealant, precisely at 3 o'clock on the posterior wall, just above the first intercostal branch. It's a pinprick, doctor, not a laceration. The room was utterly silent. No one had ever heard such a detailed, precise plan from a scrub nurse. Thorne stared at her, his expression a complex mix of disbelief, dawning comprehension, and a sudden, unwelcome respect. Dr. Sharma looked as if she'd been slapped. The other residents and nurses exchanged wide-eyed glances. Elara's humble facade had shattered, revealing a startling, formidable intellect. A microballoon and fibrin sealant, retrograde? Thorne repeated, testing the words, his mind racing to catch up. It was audacious, incredibly delicate, and utterly unprecedented. Every instinct screamed against it, yet the anatomical precision Elara had described was chillingly exact, fitting perfectly with the impossible data they'd been receiving. He looked from Elara to the chaotic monitors, then back to the quiet nurse. Her gaze was unflinching. She wasn't guessing, she knew. For all his arrogance, Thorne was a brilliant surgeon, and he recognized true insight when he heard it, even if it came from the most unlikely source. His reputation, the patient's life, hung in the balance. All right, he bit out, the word tasting like ash in his mouth. Prep the femoral artery. Get me a microcatheter. Dr. Sharma, you're on flow control. Nurse Vance, he hesitated, then met her eyes. You will guide me. Every millimeter. Every angle. It was not a request. It was an admission of need. Elara nodded, a quiet affirmation. The despair in the room began to recede, replaced by a fragile, almost terrifying hope. This was it. The moment her quiet genius would either save a life or condemn them all. As Dr. Thorne made the initial incision into the femoral artery, his movements precise but tense, Elara leaned in, her eyes fixed not on the operating field, but on the invisible landscape within the patient. Angle 45 degrees medial, doctor. Advance slowly. Watch the iliac bifurcation, slight deviation to the left. Thorne, accustomed to issuing commands, found himself taking them. He worked with an almost furious concentration, his brow furrowed, but he followed her every instruction. Confirming iliac bifurcation. Approaching descending aorta, he murmured, his voice tight. Good. Maintain that vector. You're heading superiorly now. The arch is coming up. Prepare for the curve. Elara's voice was a calm, steady current, guiding him through the dark internal labyrinth. She was seeing it all, alive, internal GPS now, gently, doctor. Rotate clockwise 5 degrees. Advance. You're at the aortic arch. The subclavian ostium is directly anterior left. Just a hair more, there. You're in. A collective gasp went around the room. Thorne had navigated the treacherous path. He pushed the microcatheter further, deeper into the subclavian artery, following Elara's quiet, unerring directives. Past the fenestration, he asked, his voice strained with concentration. Yes. Now, inflate the microballoon, Elara commanded. A moment later, Thorne reported, balloon inflated. Flow reduced. He peered into the angioscope, his eyes darting across the screen. He saw the vessel distend, just as Elara had predicted. And there it was. A tiny, almost imperceptible shimmer, a pinprick imperfection on the posterior wall, just above the first intercostal branch. The ghost in the machine, now visible, brought into stark relief by the reduced pressure. There, Thorne breathed, his voice a mixture of awe and disbelief. You were right. Gods, you were absolutely right. Fibrin sealant, doctor. Smallest possible dose. Target 3 o'clock. Steady hand, Elara instructed, her gaze unwavering. Thorne, his earlier arrogance utterly stripped away, obeyed. He meticulously injected the sealant. They watched on the monitor as the tiny defect shimmered, then slowly, miraculously, sealed. The turbulent flow calmed. The chaotic vitals on the main screen began, steadily, to normalize. The impossible had been achieved. A wave of stunned silence, then a collective sigh of relief, swept through the Pinnacle Suite. The patient was stable. The bleed was stopped. Dr. Thorne stood back, his gloved hands hanging limply, staring at the screen, then at Elara. His face, usually a mask of control, was etched with a profound, almost humbling, astonishment. Dr. Sharma, her face pale, stared at Elara as if seeing her for the very first time. The quiet, overlooked nurse, with her pristine tray and humble demeanor, had just performed an act of medical genius. The sterile air of the Pinnacle Suite, moments before thick with the unspoken dread of failure, now hummed with a different kind of energy, a bewildered silence. Dr. Thorne, the man who commanded every room he entered, remained frozen, his gaze flicking between the stabilized patient on the table and Elara. It wasn't just astonishment, it was an unraveling of his entire professional paradigm. He had been taught that genius wore a specific uniform, spoke with authority, and possessed a string of prestigious degrees. Elara, with her quiet hands and unreadable face, fit none of it. His mind, accustomed to dissecting complex surgical problems, raced to retrace the last harrowing minutes. The catastrophic bleeding, obscuring the field, the impossible pressure, the desperate, almost blind, probes. Then Elara, stepping forward, her voice a near whisper, directing his hand with a certainty that defied her station. She hadn't pointed to an obvious gush or a visible tear. She had indicated a seemingly unremarkable area, just beside an already ligated vessel, a faint, almost imperceptible discoloration on the tissue, a subtle ripple in the pattern of the outflow that only she, apparently, had seen. When he had followed her precise instruction, applying the clip to that exact, improbable spot, the bleeding had ceased. Not slowed, not diminished, but stopped. Dr. Sharma, her initial shock giving way to a dawning, unwelcome clarity, felt a cold knot form in her stomach. She had ridiculed Elara, dismissed her as a scrub nurse in a suite reserved for the medical elite. Yet, it was Elara who had seen what the chief surgeon, what she, with all their specialized training and celebrated expertise, had missed. Her eyes, still wide, dropped to Elara's hands, steady, unhurried, already beginning the meticulous process of organizing her instrument tray, a task usually deferred until the true post-op phase. Elara was not reveling in her moment, she was simply doing her job, as if saving a life from the brink of impossibility was just another item on her checklist. The anesthesiologist, Dr. Ben Carter, a man whose calm was rarely disturbed, leaned forward from behind the patient's head, his brow furrowed not with concern for the patient, but with profound curiosity. He had seen the vitals plummet, had felt the tension in the room twist into despair, and had then watched as Elara, with a soft, almost imperceptible shift in her stance, had spoken. He recalled the fractional pause, the almost imperceptible hesitation from Thorne, before he trusted the junior nurse. Carter had seen miracles, but never one so quiet, so unassuming, yet so utterly decisive. He glanced at the monitors, which now sang a steady, reassuring rhythm. The patient was out of immediate danger. The profound relief was almost overshadowed by the sheer disbelief of how. Thorne took a step closer to the operating table, his gloved fingers hovering over the site of the stopped bleed. He needed to understand. He needed to see it with his own eyes, verify the impossible. He ordered a meticulous, careful inspection of the surrounding tissue, and as the suction cleared the last vestiges of fluid, the truth became undeniable. There, precisely where Elara had directed, was a tiny, almost capillary-like vessel, tucked away beneath a fold of tissue, barely visible even under the high magnification of the surgical lights. It was not a main artery, nor a major vein, but an anomaly, a rogue pathway that, under the stress of the previous trauma, had erupted. It was a bleed so small, yet so critically positioned, that it had effectively drained the patient's life force, and so well hidden that it had eluded every other seasoned eye in the room. "It's incredible," Thorne murmured, the words feeling foreign on his tongue, a reluctant concession to a reality that defied all his ingrained professional biases. How did you see that, Nurse Vance?" The question hung in the air, weighted with genuine awe, a stark contrast to his usual imperious tone. Elara finally looked up, her blue-gray eyes meeting his, devoid of triumph or vindication. "The flow," she said, her voice still soft, almost hesitant, "it wasn't a sudden gush, Dr. Thorne. It was a consistent, subtle seepage. The patterns of red cells in the fluid, the way they moved through the field, and a slight, almost imperceptible venous engorgement in that specific area. It suggested a secondary, more insidious source, separate from the primary site you'd already secured." Her explanation, delivered with the calm precision of a seasoned pathologist, deepened the silence. Thorne, a master of anatomy, found himself processing her words, replaying the chaotic scene in his mind. He had focused on the obvious, the massive hemorrhage, the immediate crisis. Elara had seen the nuanced, the hidden, the systemic disruption that manifested in the most subtle of clues. Her patterns of red cells and venous engorgement weren't terms she'd learned from textbooks, or at least not in the way she applied them. It was an intuitive leap, a visual intelligence that parsed data invisible to others. Sharma felt a flush creep up her neck. She had been standing barely a foot away from Elara, watching, participating in the frantic search. She hadn't seen any of what Elara described. She'd been looking for something large, dramatic, a conventional crisis point. Elara had looked deeper, seen smaller, and understood more. The dismissive remarks she'd made about Elara's simple mind echoed painfully in her memory, ringing with a cruel irony. Wordlessly, Dr. Thorne removed his gloves, his movements slow, deliberate. He walked to a monitor displaying the real-time, high-definition surgical field. He zoomed in on the clipped vessel, tracing the intricate network of surrounding tissues. What Elara had done wasn't just luck, or a good guess. It was an acute, almost supernatural, diagnostic ability. He felt a profound shift within him, a humbling of his own ego that was both disorienting and, surprisingly, liberating. He had spent decades honing his skills, believing himself to be at the pinnacle of human understanding of the body. And here, a quiet nurse, barely out of her training, had demonstrated an insight that surpassed his own. The scrub tech, usually stoic, caught the eye of a circulating nurse and offered a small, almost imperceptible nod, a silent acknowledgement of the extraordinary. Even the junior residents observing from the gallery, their faces previously a mix of stress and despair, now wore expressions of stunned awe, their whispers of "Did you see that?" and "How did she?" echoing the sentiment of the room. Elara, meanwhile, continued her work, wiping down instruments, ensuring everything was sterile and ready for the next phase. Her movements were fluid, efficient, almost ritualistic. She didn't meet anyone's gaze, didn't bask in the silence, didn't accept the unspoken praise that hung heavy in the air. For her, the patient's well-being was the only validation required. The crisis was averted, the hidden threat neutralized. Her duty was fulfilled. Thorne turned from the monitor, his expression no longer astonished, but contemplative, profound. "Nurse Vance," he said, his voice lower, softer than anyone in the Pinnacle Suite had ever heard it. "You saved that patient's life. You saw what no one else did." It wasn't praise, not exactly. It was a statement of irrefutable fact, delivered with the weight of absolute conviction. It was the sound of a truly great mind, however arrogant, acknowledging a superior one, however humble. The quiet genius had not just saved a life, she had, without seeking to, irrevocably changed the landscape of perception in the elite operating theater, proving that true insight often hides behind modesty, waiting for the moment to reveal its incandescent light. Elara didn't hesitate. Her gaze, usually so deferential, now held an unshakable certainty, a quiet command. "Dr. Thorne," she murmured, her voice barely rising above the rhythmic hiss of the ventilator, "the dissection needs to be just a fraction deeper, inferior to the subcostal margin, following the facial plane. There's a subtle venous confluence there, almost invisible, but it's feeding the distal aspect of the tear. If you follow the arterial feeder proximally, you'll miss it entirely." Thorne, his brow still furrowed with the echo of his own surprise, didn't argue. He trusted his hands, but for the first time in his celebrated career, he was trusting eyes other than his own, and an instinct he couldn't fathom. He adjusted his grip on the microforceps, his movements now guided by Elara's soft, precise directives rather than his usual ingrained technique. 3 millimeters, Elara continued, her eyes fixed on the pulsating, precarious landscape within the cavity, just to the right of the aberrant branch you isolated. The bleeding is pooling there, but the source is higher, a tiny backflow. She pointed with ungloved finger, not touching, but indicating with absolute precision the exact point Thorne's instrument needed to be. The air in the Pinnacle Suite, already thick with adrenaline, became incandescent with a new, strange energy. The entire surgical team, frozen in their roles, watched the unfolding dance. Dr. Sharma, her initial shock giving way to a grudging, bewildered fascination, leaned forward, her eyes darting between Elara's still, intense face and Thorne's incredibly delicate, now guided, movements. She had never seen Thorne take direction from anyone, least of all a junior scrub nurse. Thorne, with the focus of a maestro, followed Elara's nearly imperceptible cues. He made the minute adjustment, a breath-held moment of pure surgical finesse. The microforceps reached the designated spot. There, amidst the intricate network of vessels, was the almost invisible confluence Elara had described, a cluster of tiny, fragile veins, barely discernible, that were indeed contributing to the relentless hemorrhage. With a single, expertly placed microclip, Thorne secured the confluence. The effect was instantaneous, breathtaking. The relentless crimson seep, which had threatened to overwhelm their efforts, dramatically slowed, then receded. The dark pool within the cavity began to clear, revealing the underlying tissue, no longer obscured by the incessant flow. A collective, silent gasp rippled through the room. The monitor, which had been flashing an ominous drop in blood pressure, began to stabilize, the numbers slowly creeping back into a safer range. The operating theater, moments ago a vortex of despair and frantic motion, settled into a profound, almost reverent hush. The hum of the machines, the soft beeping of monitors, the rhythmic hiss of the ventilator, these were the only sounds now, filling a space that had just witnessed the impossible. Thorne straightened, his shoulders visibly relaxing, though his eyes remained wide with a mixture of disbelief and awe. He looked from the now stabilized surgical field to Elara, who was already, with quiet efficiency, handing him the next instrument, her movements returning to their usual understated grace. Nurse Vance, Thorne's voice was a low murmur, thick with a wonder he rarely allowed himself to show. It wasn't the booming, self-assured tone of the chief surgeon, but something softer, more humble. How did you see that? Elara met his gaze, her expression serene. The pattern of the capillary blush around the tear, she explained, her voice as calm as if discussing the weather. It wasn't consistent with the main arterial bleed you'd already identified. And the subtle cyanotic mottling, almost imperceptible, was a dead giveaway for venous congestion. It suggested a secondary source, a deeper, less obvious one. Dr. Lena Sharma, who had openly ridiculed Elara just hours before, felt a flush creep up her neck. Her carefully constructed world, where status and pedigree dictated competence, had just imploded. She looked at Elara, not with scorn, but with a dawning, unwelcome respect. She had seen the same field, observed the same patterns, but her mind, trained for traditional diagnostics, had utterly failed to connect the dots in the way Elara's intuitive genius had. The shame was a bitter taste, but alongside it, a flicker of profound admiration she couldn't suppress. The anesthesiologist, Dr. Ben Carter, a man known for his unflappable demeanor, broke the silence. That was extraordinary, Nurse Vance. Truly extraordinary. I've never seen anything like it. Not in 30 years. His voice was laced with genuine reverence, echoing the sentiments of every technician, every attending, every intern in the room. Word spread like wildfire. Though the surgery wasn't complete, the critical moment had passed, unequivocally saved by the quiet nurse. The observation gallery, usually reserved for visiting dignitaries or the hospital board, filled with hushed figures. Dr. Harrison, the CEO of St. Augustine's, who had been on the verge of declaring the case lost, now watched with a face etched with relief and an almost evangelical fervor. The hospital's pristine reputation, moments from being tarnished by a high-profile failure, had been snatched from the brink. And not by its celebrated chief surgeon, but by its humblest servant. For Elara, the acclaim was almost an afterthought. Her gaze had already returned to her meticulously organized tray, her hands moving with their accustomed efficiency, preparing for the next phase of the closure. She had done her job. The patient was stable. That was all that mattered. The incandescent light of her quiet genius had shone, briefly and brilliantly, illuminating the path to salvation. But it wasn't for glory, only for life. And in that elite operating theater, where status had once reigned supreme, a new understanding had been born, that true power often wore the simplest of uniforms, and true insight spoke in the softest of whispers. The final stitch secured, the last instrument placed aside. A profound, collective exhalation rippled through the operating theater. The patient's vitals, once a frantic drumbeat of despair, now pulsed with a steady, reassuring rhythm on the monitor. The crisis was averted. Life, precarious moments ago, had claimed its victory. In the sudden, almost suffocating silence that followed the whirring of equipment and the urgent commands, every eye in the room pivoted, not to Dr. Thorne, who stood frozen, his designer scrub cap askew, but to Elara Vance. She was already clearing her pristine tray, her movements as quiet and methodical as ever. A subtle tremor, invisible to most, passed through her hands, not of fear or pride, but of the immense relief that followed such a harrowing test of skill and nerve. She checked the final 4 drip, adjusted a lead, her focus still entirely on the patient, her face a mask of professional calm. There was no theatrical flourish, no seeking of applause. She simply existed, a quiet anchor in the storm she had just quelled. The junior residents and nurses, initially stunned, began to murmur. Hushed whispers of "Did you see that?" and "How did she?" spread like wildfire. Their faces, minutes ago etched with worry, now bore a mixture of awe and dawning understanding. They had witnessed something extraordinary, a raw, intuitive brilliance that transcended years of training and hierarchical status. A nurse, older and usually unflappable, gently touched Elara's arm as she passed, a silent gesture of profound respect. The invisible nurse was visible now, bathed in an unspoken, powerful light. Dr. Julian Thorne, a man whose entire career was built on the edifice of his own perceived infallibility, found himself trapped in a tableau of his greatest professional humiliation. He stood utterly still, the blood from the critical bleed, now stemmed, a stark reminder of his near-fatal misjudgment. His jaw was tight, his eyes, usually blazing with command, now vacant, hollow. He had been a breath away from catastrophe, from losing a high-profile patient in the most elite of settings, a failure that would have irrevocably tarnished his carefully curated legend. And it was Elara, the quiet, overlooked scrub nurse, who had saved him, saved his patient, and by extension, saved St. Augustine's reputation. The gratitude he should have felt was warring with a searing, intolerable shame and rage, not at Elara, but at the unraveling of his own self-importance. He couldn't speak, couldn't move. The silence from him was a damning testament to his diminished authority. Dr. Lena Sharma, usually quick with a sarcastic jab or a dismissive glance, was equally disarmed. Her face, typically a canvas of self-assured ambition, was now pale, her eyes wide with a mixture of disbelief and a dawning, terrible comprehension. She had ridiculed Elara, dismissed her as just a scrub nurse, a creature of little consequence. Now, the very humble background she derided had proven to be the source of an insight she, with all her prestigious education, could never hope to replicate. She saw the new light in the eyes of her peers as they looked at Elara, a light that had never been directed at her, despite her relentless striving for validation. Her carefully constructed facade of superiority crumbled, revealing the insecurity beneath. She tried to catch Thorne's eye, perhaps for a shared glance of disdain or an attempt to salvage the situation, but he wouldn't look at her, lost in his own professional purgatory. The consequences began to unfold with quiet, inexorable force, far more devastating than any shouted reprimand. Thorne's reputation, once unassailable, began to fracture. The whispers in the operating theater would spread, not just among the medical staff, but inevitably to the hospital board, to the administrative executives who guarded St. Augustine's image with zealous ferocity. The story of the near-fatal error, and the miraculous intervention of a junior nurse, would be too potent to contain. Within days, Thorne found his usual roster of elite surgeries mysteriously shrinking. High-net-worth clients, known for their meticulous research and unforgiving standards, began to quietly request other surgeons. The flow of lucrative referrals, his lifeblood, dried to a trickle. His once grand pronouncements in the morning meetings were met with polite, but distinctly cool, silence. The accolades he craved vanished, replaced by a suffocating professional isolation. He was no longer the brilliant, infallible chief surgeon, he was the man who almost failed, saved by the very insignificant staff he'd so readily scorned. His arrogance, once his shield, now became his prison. For Dr. Sharma, the karmic unraveling was equally swift, though perhaps less public. Her attempts to ingratiate herself with other senior staff were met with thinly veiled disdain. Her past dismissals of Elara, her snide comments about knowing her place, resonated in a new, damning context. She was no longer seen as a rising star, but as a superficial climber who prioritized status over substance. Her applications for coveted fellowships were quietly rejected, her name conspicuously absent from prestigious research projects. The unspoken understanding among her peers was clear: she lacked true insight, true empathy, and the humility essential for genuine growth. Her ambition, once a driving force, became a millstone. The ladder she had been so eagerly climbing suddenly had rungs missing, leaving her stranded. Elara, for her part, simply continued her work. The immediate aftermath saw her retreating into her routine, meticulously documenting, assisting with post-op care. But things were irrevocably changed. The invisibility cloak she'd worn for so long had been shed. Nurses, once hesitant, now sought her quiet advice. Junior residents, instead of going straight to Thorne or Sharma, would sometimes pause, catching Elara's eye, a silent question passing between them. A new respect, profound and genuine, had been earned. She didn't ask for it, didn't demand it, but it settled around her like a warm, comforting blanket, a recognition that true strength didn't need to shout to be heard. The humble nurse, once a whisper, had become the quiet, undeniable heartbeat of the Pinnacle Suite. The aftershocks of the near catastrophe rippled through St. Augustine's, silent but potent. Dr. Julian Thorne, once a titan whose pronouncements were gospel, found his every move scrutinized. The incident in the Pinnacle Suite, though swiftly contained and officially attributed to a complex and unforeseen anatomical variation, was whispered about in hushed tones amongst the senior staff. The internal review, a discreet but thorough process, didn't publicly fault Thorne, but its findings, namely, the critical delay in identifying the aberrant vessel and the subsequent near-fatal hemorrhage, were damning enough for the hospital's executive board. Thorne was not dismissed, for his public renown still held value, but his empire began to crumble from within. High-profile surgeries, once his exclusive domain, were now increasingly assigned to other surgeons. His once unassailable position as chief surgeon of the Pinnacle Suite became administrative. His new role involved more paperwork, fewer scalpels, and a distinct lack of the adulation he craved. The sparkle in his eyes dimmed, replaced by a hollow frustration. His arrogance, stripped of its functional power, now just seemed pathetic. He no longer barked orders, he merely issued directives that held less weight than the rustle of a patient's gown. His world, built on external validation and the unwavering certainty of his own genius, had been subtly but irrevocably destabilized. He remained, but only as a ghost of his former self, a cautionary tale of how quickly a star could fade when true talent was overlooked for too long. Dr. Lena Sharma, Thorne's most fervent acolyte, felt the chill wind of change even more acutely. Without Thorne's reflected glory, her own social currency plummeted. The residents she once mocked now met her with cool professionalism, their eyes holding a quiet judgment that spoke volumes. Her attempts at witty, cutting remarks fell flat, echoing in sterile corridors no longer filled with fawning listeners. Her drive for status, once fueled by the prospect of rising alongside Thorne, now felt like a desperate scrabble up a slippery wall. The pathways to elite fellowships and coveted appointments, once seemingly assured, now looked impossibly steep. Her talent was adequate, but her character, once shielded by Thorne's eminence, was now exposed, revealing a person who valued superficiality over substance. She found herself increasingly isolated, her ambition curdling into resentment as she watched others, less outwardly ambitious but more genuinely skilled, advance past her. The external approval she desperately sought vanished, leaving her adrift in a sea of professional indifference. For Elara, the days that followed were a gradual unveiling of a new, quiet reality. There were no grand gestures, no public accolades. That wasn't her way, and St. Augustine's, ever conscious of its pristine image, preferred a discreet handling of such matters. Yet, the change was profound. The chief of medicine, a man rarely seen outside his executive office, paid Elara a visit in the staff lounge, offering a sincere, personal thank you, and discreetly inquiring if she had ever considered advanced training, perhaps even a path to medical school, with the hospital's full financial backing. Elara listened patiently, her hands carefully arranging surgical instruments on a tray, an automatic, meditative task. "Sir," she replied, her voice soft but clear, "I appreciate the incredible offer. It truly means a lot. But my place, my purpose, it feels clearest here. As a nurse. I like being the one who ensures every detail, who sees the patient not just as a case, but as a person, even when they're asleep on the table." She explained, without fanfare, that her unique perspective thrived in the environment of direct care and meticulous preparation, that the diagnostic clarity she possessed was best utilized as an integrated part of a team, not necessarily at its head. Her worth, she knew, wasn't measured by a title or a degree, but by the quiet confidence in her own abilities, by the intricate dance of her mind as it mapped internal landscapes. Her decision was met not with disappointment, but with a deeper, richer respect. The hospital instead created a new, informal position for her, lead surgical support specialist for the Pinnacle Suite. It came with a modest raise and, more importantly, a mandate for her input to be actively sought and valued by all surgical staff, regardless of rank, during critical procedures. There was no fanfare, just a memo, but its implications were clear. Elara now had a voice, not because she demanded it, but because her quiet competence had earned it. Her scrubs remained the same, basic and slightly ill-fitting, but now she wore them with an unshakable sense of belonging. Her tray was still pristine, her movements still efficient, but there was a new lightness in her step, a quiet hum of satisfaction that resonated from within. She still observed more than she spoke, but now, when her gaze lingered, surgeons instinctively paused, awaiting her input. Junior residents no longer just caught her eye, they sought her out, asking for her unique insights before they even approached a senior attending. She didn't become a celebrity nurse, nor did she desire it. She didn't seek external approval, for she had already found a profound wellspring of it within herself. Her satisfaction came from the subtle shift in a patient's breathing, the precise placement of a suture, the seamless flow of an operation where her silent vigilance had averted a crisis. She still occasionally walked home in the pre-dawn hours, the city lights painting long shadows, but the weight on her shoulders was gone, replaced by an inner peace. The humble nurse, once merely a whisper in the grand halls of St. Augustine's, had indeed become the quiet, undeniable heartbeat of the Pinnacle Suite. But more importantly, Elara had become the undeniable heartbeat of her own life, choosing her path not from a desire for glory, but from a deep, authentic understanding of her true self and where her unique gifts could best serve. Her worth was never in question, it was simply waiting for the world to catch up, and now, it finally had. She knew who she was, and that was more than enough. So, what do you think? For me, that story underscores the incredible power we hold, to adapt, grow, and find light even in darkness. It's a powerful reminder, every challenge is an opportunity to rediscover what truly matters. Now, I'd love to hear your thoughts. What resonated most? Do you have your own story of resilience or growth? Share it in the comments below. Let's build a community where we learn and uplift each other. Your voice matters. If this message resonated, or you enjoyed this journey with me, please hit that follow button. Join our family for more stories that inspire and connect us. Let's explore the incredible human spirit together.